Welcome to DBC Diaries episode 51. Today you're going to see returning patient Gary. Gary has hurt his neck doing a lot of Jiu Jitsu over the years. Really fun sport, but leads to a lot of injuries. We've helped a lot of guys with Jiu Jitsu injuries, typically back injuries, sometimes knees, sometimes shoulders or elbows. I mean, you can get hurt just about anywhere in that sport. But we've been helping a lot of these people to recover. And in Gary's instance, it was his neck we treated last time. He's doing really well, so he came back to just do some more cells just as kind of a top up to keep him going well and get him back to the gym. So if you want to learn more, stay tuned. You'll see what it's like to be a patient at Dream Body Clinic, and you'll get to hear from Gary himself as to how the stem cells have helped him. DBC Diaries Day 1. Today, Gary arrives, he gets into the airport, goes through baggage claim, through the main airport, goes outside where he'll see our driver with the sign with his name on it waiting for him. Our driver is going to get him to his hotel, and then he can rest, relax, enjoy the rest of the day. DBC Diaries Day 2. Today we want patients to arrive fasted because we're going to start with a blood draw. So we need you to not eat after midnight the night before, water only in the morning. Once we do the blood draw and some basic analysis, we then go up to our open MRI machine where we're going to scan Gary's neck, see exactly what's going on. Each area for an MRI takes about 45 minutes to do. It's not the most fun thing, but luckily we have the open MRI, which makes it very bearable and easy. Once that's done, he's going to go with our driver back to his hotel where he can go enjoy the beach, enjoy the food, all the great things Puerto Vallarta has to offer.
Right now, we're starting Gary's MRI scan. You can see in the videos how easy it is with this machine we have here at the clinic.
DBC Diaries Day 3. Today is consultation day. We're going to sit down with the doctor. They're going to go through his blood work. They're going to go through his MRIs image by image so he knows exactly what's going on, where he is now versus last time. We can see exactly where he's at, how much improvement we've seen, which in his case has been a lot, which is great. And then the doctor will determine, hey, you're a good candidate, you're not. Obviously in a case like Gary's, he is, because we've done this before. But, for some people, we do find things that might mean it's not the right fit. It's pretty rare, but that's why we do this. Safety first, want to make sure we're doing the right thing and that we can target the cells in the right area. Once that is done, we go upstairs with our admin department, take care of payment, and then our driver is going to take Gary back to his hotel so he can rest up for treatment the next day.
So today, Gary Foster will come to review the new MRI. The last time that he came, he do the next MRI. We saw that he has in the left side of C6 to C7 like a foraminal narrowing, and now in the new one we can check that he improved it a lot. He still has the bulging disc, but not a lot like the last time, and the foraminal narrowing improved a lot.
DBC Diaries Day 4. Today's treatment day. Gary knows what to expect, but for you out there that haven't done this, It's real simple. You come in, our doctor's just going to answer any last questions. He's going to explain some of the post-treatment protocols. We give a routine for stretching. Typically with joints, it's a 6-week of, we want you to not do any major exercise, 2 weeks, nothing major, 4 weeks, light rehab protocol that we provide. We always give patients some Tramoset as a just in case if there's any pain at the injection point. And then we go in for treatment. It's real simple, quick, easy injections. Then we sit down for the IV portion of treatment. And that's what you're going to see now. Gary doing that, talking with me, explaining the results he's seen with stem cell therapy.
After the IV, Gary will move to the treatment room to receive 4 shots in his cervical area.
Hi, welcome to DBC Diaries, episode 51. I'm here with returning patient Gary. Thanks for coming back, Gary. And you've been dealing with some neck pain, some Jiu Jitsu injuries. What else been going on?
Yes, the Jiu Jitsu really messed my neck up. When I finally figured out what it was, my atlas is out of alignment by like 23 degrees, and the C2, the next disc, was out of line by about 12 degrees, the opposite direction.
Oh, wow.
So it's causing problems all throughout my body. It's putting pressure on my brainstem, my spinal cord, my vagus nerve. It was brutal. I would get these migraines that would last for 2 days, where I would just be like done for 2 days, almost exact, before I could think again. But after seeing a lot of doctors, and my first trip here made it improved like 50% better. And I didn't really know what was fully wrong at that point. But once it got the atlas realigned and the C2 realigned, things just, my brain, it was just like, I came back alive. I'm like, wow, this is living. I thought it was just like old age before, but it's amazing now. Like, I actually think, have a thought.
Well, you were telling me you were getting lots of brain fog from it, right?
It was constant brain fog. It was constant.
Got it.
I was just living in brain fog. I thought it's like, okay, this is what it's like when you get in your 50s. All right, this kind of sucks. But no, it's like, man, I feel alive again, doing stuff, thinking.
Got it. And so was it about, a year ago when you were here last? Or
Yeah,
what
it was about a year ago. Yeah.
And so we came in, we did the MRI. I mean, you can see some of that stuff there, but
Right,
it's
like some disc injuries, some other issues that were healed also.
Yeah, but the alignment wise, I mean, that's a mechanical issue. So the stem cells can't fix that.
No.
So that's why it's so good. It was a chiropractor that you ended up.
Yeah, she specialized in, I think, an orthogonist chiropractor, where they specialize on the atlas and in getting that realigned. She's like a sonic gun that kind of sent a little pulse, and you're like, okay, it was it. Then she did an x-ray, and it was like really close.
Okay,
it was amazing. And it was just like my body just like went into recovery mode, could function again at night. The next day I'm like, oh my God, I got so much energy. I'm not used to this. I'm just like having coffee to like just barely feel alive. And
And was that like one treatment with what she did, or multiple?
It was one treatment.
Wow.
The first one was one treatment. It made a significant difference. I mean, it was pushing on my spinal cord and brainstem. You just like in a constant dead state, basically. You never recover at night. It was brutal.
So we got you said about 50%. And then did that get you the rest of the way, or like, how are you feeling now?
That stopped the brain fog, but I still have the instability.
Got it.
So like, it happens when I'm asleep, right? I don't know what's happening, moving. Like, I'll wake up with this morning I was up at 3 a.m. with a headache, a really bad headache. Had to go get double espresso to like kind of numb it out.
Okay.
So that still happens now, but they're not like a spike nail through my head. They're like, oh, that doesn't feel good at all. It's really annoying. Versus like, I'm gonna throw up because I feel so sick from the headache. That's how bad they used to be.
Got it. Oh man, that's a big difference. So
I'm hoping it helps some of the ligaments get stabilized and
exactly. And stem cells do great with that. With like ligaments, we've seen a lot of people with instability, with they're hyperextended, and the cells get in there and they start guiding that repair process. And we've seen it consistently tighten up, repair tears, rehydrate discs if they're herniated, and it's really awesome that it's helped your neck so much.
It's been amazing. Yeah, it's just the difference between not surviving and living. It's huge.
Got it. And so we do an IV portion with the neck also. Did you see anything from that? I mean, I noticed my immune system was working better, but some people notice little things, some don't notice much at all.
Like the neck, like The next day after the treatment, I felt like Superman or like a moth.
That's good.
Despite everything that was still going on, I felt like Superman.
Oh, good, good. All right. Well, hopefully we'll get you there, back to it, and keep you there this time. That's the goal. And sometimes, yeah, it's great. You have to figure out like some of these alignment things, different things to complement. And now we should be able to get you over the top that you're back in alignment. And, next time you're here, it's hopefully for something else,
Yeah, next time it'll probably be for my back.
Got it. Oh, yeah. You were telling me your lower back has some issues. So you fix a lot of those. And I've had both issues. I had neck 2 years ago, lower back about 4 years ago, and it takes some time. I always like to let people know. I mean, you got, fortunately, I mean, it sucks. It was so bad where you were at before, you saw some relief right away. Most people, though, it takes some time. Like nerve pain, typically within a few weeks, but like that tightness, the pressure, the pain in the neck or the back, like it takes usually 3 to 6 months.
Yeah.
So my neck, it was weird. It didn't feel any better for like 5 months. And I went in, I'd never gone to a chiropractor before. And I went to one, he did a quick adjustment. And like, yeah, the next day, it was about a week later. Yeah. And I never had pain again.
Yeah.
The stem cells have done their job. And I probably just needed an alignment like you.
Yeah.
That would make sense,
What was weird about it is like I didn't feel pain in my neck except when I had the headaches. So I couldn't connect the two with all the other symptoms.
That makes sense.
Yeah, it's bizarre.
Well, thanks for coming to us. Thanks for trusting us. Thanks for sharing. This helps other people out there.
Thank you guys. And I hope it does help other people out there, especially with Jiu Jitsu injuries.
Oh, yeah. The subtle art of folding clothes while people are still in them, right?
Yeah.
That's a tough one. So if you're out there and you're watching this and you'd like to learn more about stem cells and how they could help your neck or other injuries or autoimmune diseases or anti-aging, there's a lot of things stem cells can do. You can go to our website at www.dreambody.clinic. Scroll down on the homepage, you'll see all the treatments. You can click on them. They got info, links to studies, prices, everything's there for you. And if you want to call us, we do free consultations. We'll review any MRIs you have or scans at no cost. And you can call us at 888-704-3977. I'm Josh. Happy to help. DBC Diaries Day 5. This is Departure Day. This is it. I want to thank Gary for sharing this with everyone out there. Hope this can help all of you out there. Any guys out there or women practicing Jiu Jitsu. Hope this will help you, give you an option to heal up faster. And anyone else, if you want to learn more about stem cell therapies, please go to our website at www.dreambody.clinic. Scroll down on the homepage. All the treatments are listed right there. Just click on the links. They've got info, studies, prices, everything you need. And if you want a free consultation, please call us anytime, toll free at 888-704-3977. I'm Josh, happy to help.